Yeah, hi everyone. Welcome to my channel again. Once more, I'm Dr. WAN, and I'm here to talk about medication reconciliation, or some call it med check or PMR. So essentially, it is with regards to your medication, whether you are on it, do you still need to use it, and how long are you to stay on it? Are you in constant touch with your doctor? So these are all some of the questions, and it is a very broad topic when it comes to medicine. It plays a key role. I always call it a pivotal role when it comes to medication administration. So let me go first of all with the definition what it is. Medication reconciliation is a process of reviewing and comparing a patient's medication list to avoid medication errors. It is usually done by a pharmacist during a patient's admission, transfer, or discharge. So there are three things here. It may involve consulting different sources such as patients, their relatives, their primary care physician, or their medication orders. The goal is to ensure that the patient's medication list is accurate and up to date. So this is the key thing here. So you'll be surprised that this topic that I'm touching right now affects not only black people, not only you guys in Africa, also even here in North America. It's a big issue here. Europe, same story. So many patients have died as a result of poor med check or medication review. So don't feel that I'm doing this just for the African population. No, it's meant for the world at large because it's a big topic. I want to take a very simple example, the most popular medication used in the whole world. Paracetamol. Paracetamol is a popular medication used all over the world. It is considered as an OTC, over-the-counter medication. In French, we say médicament en vente libre. So the fact that it is an OTC doesn't mean that it is safe. So that paracetamol comes with so many names that you cannot imagine. For instance, in Canada and USA, they call it Tylenol. In Ireland and UK, they call it Panadol. So you have these names that are just too many. In France, we say Dolaprane. So you can imagine how the names are all changing, but the molecule remains the same. Now, here's the whole thing. Whenever you are put on medication in general, that medication, you are supposed to take it for a maximum of 28-30 days. So in the Western world, we say 28 because a week is made up of 7 days. So 7 times 4 makes 28. Some doctor might want to add extra 2 days to make it 30. So that's the whole thing here. So if they put you on any medication, that drug is scheduled to be consumed within that time frame, meaning that you will have to go back to your prescriber, your doctor, for a proper check, another assessment to see if you still need that medication or you don't need it any longer. So that's how it is done here in the Western world. And I'm pretty sure in Africa, it is supposed to be done that same way to avoid this disaster. It's a very big problem. People die not because they never went to school. No, some are able to read and write, but they don't understand the importance of medication review or med check. In other words, we call it also pharmaceutical care. So that pharmaceutical care is a triangle. That is, the nurse is a key player. Your prescriber is another one. Your family. So you, the patient, you are in the middle of that triangle. It's like this shape. So the nurse is that way, the doctor is this way, and your family. So these three personalities have to work together to make sure that you are in good shape. So that's what is needed here. So if you are put on a medication and you are changing from one hospital to the other, say for instance, you were admitted in a hospital in Burundi and you happen to find yourself in Kigali, you are supposed to carry with you all your medication. And having said that, there are 3 stages here. Before you get into the hospital, there's another control. While in the hospital, there's another control, which we say patient engagement. That is, a nurse is there to make sure that you are taking the right medication, the right time, the right dose for the right purpose, the right reason. We call it the 10 hours rules. The 10 hours rules. I made a video for that to explain to you people what it means. So that's the delicate point here. And then during discharge, another control. So there are 3 in total when it comes to this med-check principle, which if it's not respected, you find yourself dead. There's no magic here. It is no witchcraft. It's just responsibility. So please take it serious. This thing has been going on, and it will keep going on and on. You have a role to play. If you are not able to read and write, get a pharmacist. Get a nurse who has a good therapeutic background. A nurse who understands medication. Otherwise, you will kill yourself inadvertently. It is not a question of not being able to read or not being able to write, or being poor or rich. It doesn't matter. Even rich people die the same way also. They end up taking double dose of a medication that they were not supposed to take. So this message is for you. One more time, med-check is a key thing when it comes to healthcare. So take home message. Patients often receive new medications or have changes made to their existing medication at times of transitions in care upon hospital admission, transfer from one unit to another during hospitalization, or discharge from the hospital to home or another facility. So that's the key thing here. Although most of these changes are intentional, unintended charges occur frequently for a variety of reasons. For example, hospital-based clinicians might not be able to easily access patients' complete pre-admission medication list, or be unaware of recent medication changes. So that's what I'm saying here. You have a role to play. If you're not able to talk or communicate, your family has to do that to keep you safe. Otherwise, you end up dying unknowingly. So please, let's be serious. Medication are not candies. So know what you're doing. Get someone to help you. Get a pharmacist, and he or she will do that for you properly. Let's avoid unacceptable death or such errors. Once more, thank you for following up my channel. Please click, sign, subscribe, like it, share with your family. My name is Dr. WAN. Thank you and have a wonderful evening. Remember, there is only one you. Keep it at that. Ciao.